From 12 News, this is Newsmakers.
From a stock market roller coaster,
it is all red,
to a fresh Rhode Island healthcare crisis.
We didn't get that opportunity here, but so now we're playing a little catch up.
It was another jam-packed week in the news. As Washington and China engage in a full-scale trade war, what will be the ripple effects here at home? And what are 25,000 local patients supposed to do now that their primary care practice is abruptly closing? This week on Newsmakers, we'll tackle those topics and much more with a Reporters Roundtable. Welcome to Newsmakers. I'm Tim White, alongside 12 News politics editor Ted Nesi. And for this Reporters Roundtable, we welcome back Patrick Anderson from the Providence Journal and Nancy Lavin from Rhode Island Current. Welcome back. Good to have you both here.
Great to be here.
I really need to I put this warning in our show all the time, but particularly today, we tape on a Friday morning and things are fluid, to say the least, in the news cycle right now, so a lot can change from what we're talking about. But I do want to start with tariffs and the financial roller coaster of the Trump tariff policy that has put everything into uncertainty. The ripple effects touch everything. And Ted, thinking about it this morning, before you came to the dark side of television news, you were a business reporter. How are you thinking about all of this?
Well, it is a roller coaster, and I think just before we came on the air this morning, I was looking, and U.S. Treasuries were rising, and the dollar was sinking, and there was talk of maybe the president's going to try to talk to Xi Jinping. Who knows how it'll change even by the time the markets close today at 4 o'clock. But I guess I am still, like a lot of people watching, just there's two paths here. There's the path of this has been a lot of drama, but we're going to whether the market backlash means the White House is going to rapidly backtrack and tariffs maybe will be a bit higher, but not nearly what's been proposed to this point, even the current proposal, which is different from the first proposal.
Right.
Or the president is intent on this and is okay with quite a bit of disruption. And if that's the case, there's going to be a massive amount of change necessary with global supply chains and where companies get things, the price of goods in the United States. And that would have ripple effects all over the place. So I think there's still a bit of a wait and see. I don't think markets are convinced yet that this is a permanent new regime, but they're starting to get more nervous it might be.
And as we all know, businesses really love uncertainty, right? And that's nothing else. If it's option A or option B that you just laid out, what we do know is things are just, we don't know. And that uncertainty is really challenging. And I kind of want to bring it locally to both of you, Nancy and Patrick, and try to get our arms around the local impacts here. What are you watching with the tariffs or thinking about? We'll start with you, Patrick.
Well, it almost has this feel a little bit, maybe because it's April and gray and cold out. From an economic standpoint, it almost feels like the beginning of COVID a little bit, where no one knew what was going to go on, and there were fears of recession, and really no one could predict, and there was a ton of uncertainty. And then the implications of that financially kind of did whiplash and ricochet for months and years onward. And everyone is just watching and locally feels a little bit powerless, both on the government level and on the private sector level, that they just don't have a huge amount of control about what's going to happen. As far as businesses, they are not talking. The larger businesses in Rhode Island, even some smaller ones, if you ask them how the tariffs are going to affect their business, they generally just do not want to address the question, both because it's likely to change, and there is also, I think, a sense that you don't want to bring attention on yourself from the administration that could potentially, from potential reprisals. So they're extremely quiet about it. But it really is kind of rippling through everything from Hasbro, where we don't know what's going on because their stock has gotten crushed. They have such exposure to Asia where a lot of their products are made, and we don't know how that's going to affect where they are located.
Nancy?
Yeah, I mean, I think we're seeing this, as you guys said, across all different levels. And of course, consumers, what happens in government, what happens in business, then affects consumers. And no one knows what to do. And I think, like Patrick said, even during COVID, I worked for a business paper during COVID. Even when we knew COVID was crushing our economy and crushing our healthcare system, businesses still wouldn't talk about it. They just wanted to keep saying, oh, we're pivoting. That was like the phrase of 2020,
whatever
2021, 2022. One thing that I do think will be interesting, I cover energy and the environment. Offshore wind has been a huge focus of Rhode Island by government officials and the private sector.
Which was already facing headwinds from the Trump administration.
Already in
No
big
pun
trouble
intended.
because of just the policy around renewable energy. But now, and we've already seen this in the last few years, the supply chain problems with all of these materials and also the workers who come from different countries to work on these projects and, you know, all the different facets of it. Those costs are going to keep going up, and what that's going to mean is we're going to see more projects get canceled, more developers try to renege on their agreements with state utility companies like Rhode Island Energy for what they want to be paid to supply energy to a utility company, which in turn impacts what we as consumers pay. And Rhode Island and the McKee administration, and before that, Governor Raimondo, hedged a lot on Rhode Island's blue economy, so that could all kind of be gone.
Did we have the right panel? Because I think all three of us are Providence Business News alums,
Yes.
right? So you're surrounded.
Yes, it's a little overwhelming, if I'm being honest. Did Patrick kind of give a bit of a silver lining into the tariff thing? I mean, could this mean because Hasbro is just so beholden to Asia, could they stay?
I think you can't take that off the table. I mean, you know, from what I hear, and I think you two are hearing the same thing, you know, the conventional wisdom around the State House is they are probably gone, or at least that was the conventional wisdom pre-tariffs. Now the question is, with Hasbro so exposed, their stock was down 20% when I checked Thursday evening after the markets closed. Their exposure to tariffs, their supply chain, you know, they own Pawtucket. It's cheap. Now, I know the C-suite doesn't like it there anymore, and it is, you know, it's seen better days. But are you going to go out and tell your investors, hey, in the midst of all this disruption, all these new costs, a whole refashioning our supply chain, by the way, we're going to spend a bunch of money on a fancy new headquarters in the seaport? I don't know. Now, that, by the way, might not mean they stay forever. Maybe they punt. But it's put some uncertainty in anyway, and now they're saying we won't know till summer where they're going to go.
So, as we approach summer, the General Assembly is hammering out their budget right now, and they have to get it done for the new fiscal year of July 1. How are they planning a state budget in this level of financial uncertainty right now?
They're sweating, and you can tell when you talk to the speaker that there's a little bit of anxiety starting to build and build and build. I think in terms of the tax revenue, they're probably not going to be in terrible shape. Like through February, collections were okay, and I think most of the impact is going to be pushed a little bit further in the year, although we don't know if things really go bad.
We'll know in May, right? They do the conference in May.
Right.
Yeah.
Yeah. We'll know in May, but I think, and even then they're projecting out. But I think the real thing that is really causing them stress is healthcare and Medicaid, because Congress is still working through its budget, which includes huge Medicaid cuts, which would trickle down to the states, and that would blow a massive hole in the budget, either forcing the state to come up with the money to replace that to keep services as they are, or forcing cuts that would be very painful.
Well, in the next block in this program, we're going to talk about healthcare and Anchor Medical and all the implications of that. One last thing before we go to break, Ted, that I wanted to bring up with all of the changes from the Trump administration, because we haven't really had a chance to talk about it on the show, except I had Mark Parlange, the president of URI, last week. He reacted to Brown University. $500 million at last reporting that is potentially being frozen by the Trump administration. That could have enormous impacts on that IB.
Yeah, I mean, you know, Rhode Island's whole life sciences push rests on a foundation of Brown. You know, URI is important, other institutions are important, but having an Ivy League school with ambitions to compete with its, you know, bigger rivals in that, you know, weight class, Harvard, Yale, et cetera, is part of why Rhode Island has felt that they could make a move on this. And it's strange in part because the administration still has not officially notified Brown, or had not as of Thursday when I checked in with Brown, even though the White House told me and other reporters last week they were going to freeze all this funding and do a big review. Chris Paxson, Patrick tweeted out actually, I think, a Brown Daily Herald story about what she was saying internally to the faculty about being not sure she wanted to play ball as much as Columbia did. Did that really help Columbia? So, and that's just one of the disruptions Brown is facing. There's the, you know, student immigration issues that are roiling campus. So I think there's a lot of different disruptions being put down by the administration that, granted, they're not unhappy about. They want to shake up how the Ivy League schools are. But, when Rhode Island has based a lot of plans on these places being stable and growing, maybe some of those plans will have to change.
All right, why don't we take a break on the program? As I said, when we come back, 25,000 people will soon be without a doctor with Anchor Medical closing. We talk about that and the ripple effects it has on the health industry overall in Rhode Island. Stay with us. You're watching Newsmakers. Welcome back to Newsmakers and this Reporters Roundtable. I'm Tim White. This is Ted Nesi from the Providence Journal. We have Patrick Anderson in from Rhode Island Current. We have Nancy Lavin. So Anchor Medical announced they are closing their doors, impacting some 25,000 patients. First, let's start with the governor here. We caught up with Dan McKee earlier this week. Here's what he had to say.
So we're connecting the leadership in with other providers in the state to see whether we can absorb some of the physicians and also the patient load. We'll have more on that to come, but we are proactively working, and we would have been proactively working on a strategy if we got what Thunder Mist gave us an update. We months in advance that they had an issue, we were able to come in and actually help them sustain themselves. So we didn't get that opportunity here, but so now we're playing a little catch up.
So Nancy Lavin, sensing a little frustration from the governor there.
Yeah, I think it's a fair point that knowing beforehand might have been good. However, we're already in a huge primary care crisis. Even if the state had known a year ago that this was going to happen, we do not have the medical staff available in Rhode Island to absorb 25,000 patients. We don't even have the staff to absorb everyone else who's still on like a long waiting list for a doctor. So I think there's like a little bit of shifting blame there.
Patrick, Anchor Medical, and what are the ripple effects for the health industry overall in Rhode Island, do you think?
It just continues the trend that we're seeing, and there really isn't a plan right now to deal with either the primary care shortage or the related hospital pressure, financial pressure, which comes from lower reimbursement rates in Rhode Island than our neighbors. The closest they have to a plan on dealing with reimbursement rates is to study it, which they've also been planning to plan on studying it for I think 3 years. But the actual increase in funding is not on the table this year, and the hospitals are actually screaming about what they consider cuts to potential funding. So I don't see a great outcome. Whether Anchor Medical called McKee to give him warning or not is kind of beside the point of anything that patients or doctors will have to deal with. There isn't a great solution to this.
Yeah, we're hearing ever since we broke the story last Friday, we've heard from patients every day in the newsroom, emails, calls from people.
They heard it, a lot of them heard it from us.
That's true. We heard people who heard our report before they got the notification from Anchor. And, one thing we have not gotten clarity on is, as multiple people have said, well, all these doctors still exist who work there now.
That's true.
And so are they going to move to a new practice, take their patients? Will it be a much smaller effect once the disruption is worked through? I just truly don't know. I'm sure the governor wishes he had clarity on that in advance too. But I think to Nancy's point and Patrick's, yes, we need individual institutions. Maybe the governor would like them to come forward and say, hey, we're the ones who might go belly up this month. Can you help us this month? Thunder Mist, now Anchor. But clearly the problem is a broad systemic one across Rhode Island healthcare, which I think at least some state leaders, certainly the Attorney General, I think the Speaker has got religion on this, but I think the scale of money and support needed to really stabilize things is just hard to fathom, especially what we talked about in the A block of the show with economic disruptions and the state already in a deficit. It's just very concerning.
Yeah, I have to tell you, your Saturday column last week, the opening item to that, thrust me into depression for the rest of the weekend.
Yeah, right.
Because you were pointing out that it was everything that we've been discussing with the healthcare situation and all the other uncertainty right now. it's tough, particularly Rhode Island. What's the saying about Rhode Island, where they're first into a recession and the last out, right?
Yeah, Massachusetts sneezes and around catches a cold, that kind of thing, right? And you have to always be on guard. I think you three would agree that to negativity bias as a reporter, right? Like we
can be grumpy.
Bad news is news, right?
People have said that CVS could be more well positioned relatively to some other places. So maybe
CVS got good news this week. The Trump administration gave a unexpectedly big bump in their Medicare Advantage rates, right? So, and they were the best performing stock in the S&P in the first quarter with their new C-suite since Karen Lynch got bounced, et cetera. So it's not all bad, but I think the thing is with both the economy stuff and the healthcare stuff are just massive, difficult, expensive problems that affect just about everybody. I think everybody.
Shifting gears, Nancy, you did some reporting on this. Is this going to be the year of an inspector general in Rhode Island?
The State House Republicans sure hope so, but I'm not sure that their arguments. They've had 23 years to perfect this bill, so it's a lot longer than it's been. It's a lot more detailed. It tries to head off a lot of the concerns.
Well, just explain what it would look like.
Sure. So the main idea is similar, modeled after Massachusetts in at least one of the bills, a separate independent office to investigate, audit, subpoena any state agency, local agency, government official looking for fraud, waste, abuse, corruption, issue reports, work with the Attorney General and the U.S. Attorney's Office when needed, and sort of like save money for taxpayers is the general premise. The sort of pushback that we hear every year, and we're hearing again this year already from the Speaker, is we already have all of these other investigative and auditing agencies. We have an Auditor General, we have an Office of Internal Audit, we have an Attorney General. So why do we need this? And then the other thing is it's going to cost $1.5 million, they estimate, to create this office with the Inspector General and his employees. And we don't have any money right now.
Well, I have an idea that will cost the state nothing. Let's give investigative reporters subpoena power.
We'll take it.
And then you won't need an inspector general at all. We already kind of played that role. All right.
Bill, I moved past.
Yeah, right.
Seconded. All right, I love it.
And one interesting tidbit on that is that the ACLU raised concerns with the bills because in both of the bills, the whole purpose of this is like saving money and also public transparency, holding government accountable.
Sure.
As written, the bill said that any investigations, audits, reports by the Inspector General would remain confidential. Mm-hmm. So the ACLU was like, hey, needs to be part of public records law. We need to make these public.
Yeah, all right. I was not aware of that aspect. It is a good point. We're going to take a break here on Newsmakers. When we come back, there's a new bishop in town. Stay with us. You're watching Newsmakers. Welcome back to Newsmakers. I'm Tim White for this Reporters Roundtable. Of course, we have Ted Nesi, and from the Providence Journal, Patrick Anderson, and from Rhode Island Current, Nancy Lavin. So the Most Reverend Bruce Lewandowski is the next bishop of the Roman Catholic Diocese of Providence. He wants to be called Bishop Bruce. I like the alliteration. He replaces Bishop Richard Henning, who is here for a very short time. His predecessor, Bishop Thomas Tobin, would ruffle feathers, I would say, because he was, relatively speaking, a politically active prelate and a conservative one. Bishop Lewandowski was asked about politics and all of that. This is what he had to say.
We need to know issues before we jump to quick judgments about things. So government acts, it does things, and right away our emotions might flare. I would say, calm down, Bruce, stop, wait a minute. Let's think this through. Let's study it. Let's try to get underneath what's going on and really find out what's happening. And sometimes we're surprised. Our first perceptions or ideas about things might not be correct, or they might be off a little bit, or they might be correct. But you don't know that until you study things and delve into them a little bit.
The new bishop of the Roman Catholic Diocese of Providence, Bruce Lewandowski. What do we know about him?
He came from Maryland, where he's been stationed recently. He's 57, grew up on a farm in Iowa. He speaks fluent Spanish and Portuguese, been very involved with immigration, immigrant communities over the years. One source in the church told me he sees him so far as sort of a Francis bishop, like in the mold of Pope Francis, a bit more on the moderate, maybe even to the liberal side of things. I don't know enough yet to say if I'm sure that's the case, but that's a little bit of the initial perception.
All right. We're going to shift gears because I want to cover a couple of quick things. So, Patrick, you've done some good reporting in the area of state capital projects and sticker shock on that. And initially going into the headline, I thought, oh, this is a story about tariffs. but it wasn't.
No, they have had plans for a while to consolidate some of the facilities at the ACI, which in a positive development are not as full of inmates as they used to be. But this one, to downsize minimum security, they didn't actually take into account any of the costs of what it would cost to put them into medium security. So it looks like that was actually just sort of a budget move where they took the savings but didn't take the costs. So that is off.
I mean, say the two numbers, the initial and the...
Oh, 1 million versus something between 70 and 90 million. So a bit of a...
Close.
Yeah.
Missed it by that much.
Yeah, just that much. It's an interesting way to do cost savings. But on other capital projects with tariffs, I think things like new high schools where there are cost estimates. Pawtucket just broke ground. If a lot of the tariffs happen, those cost estimates are probably not going to come in where they were. So any building project right now, there's a big question mark hanging over it.
Yeah, I mean, I had Mark Parlange, as I said, from URI. They have a bunch of capital projects going on, and he admitted that it is going to be sticker shock with those projects. They're just sort of estimating that at this point right now. So sticking with the McKee administration, Nancy, you've done some reporting on this. They sort of strode into a public relations minefield with the governor's proposal to pay for a pay increase to his cabinet heads. And as you reported, the timing of that sort of rubbed some people the wrong way.
Yeah, I mean, the governor proposes or can propose raises for his cabinet members every year. No one really likes it, but typically the legislature just kind of says like, okay, or maybe can you take these down a teeny bit. Obviously, the funding shortfalls that we're projecting, it's not a ripe time for raises for people who are already making 6 figures.
Yeah.
But particularly for the other state employees who work for their bosses, it's pretty unpalatable right now because they have been asking for their own sort of reclassification. I should be a senior so-and-so because I've been doing this job for 50 years. The 4 other people in my department have left, so I'm really doing 5 people's jobs. And they have not been able to have the public hearing that allows for them to be reclassified for over a year and a half. And the state is blaming that on a software upgrade.
And that software upgrade, I should say, talk about Arcane, but Nancy and I know both have it. I'm sure you do too, Patrick. This is the ERP system for finance and HR and payroll. The budget's been ticking up and up and up on that. It's supposed to roll out later this year. I don't have to tell viewers that IT projects in around state government have not always covered themselves in glory. So there's a lot of close watching. I'm not saying people are saying it's not going to work yet, but after previous things, there's a little nervousness.
Can you do this in 30 seconds?
Always.
Are pensioners worried, out there worried about the stock market and what's going on and how that could impact their retirement?
I mean, I think everyone should always, be realistic about what the market moves mean. But I think the state, the way it's structured is that a big plunge in the stock market is not rolled into the actual pension contribution calculation for a couple of years and hits the state budget. I will say the way the pension system is now, the COLA increases are tied to investment returns. So that is something that state retirees want to be aware of.
We'll keep a watch on that. All right, Patrick Anderson, Nancy Lavin, Ted Nesi, thanks so much. We'll see you next week on Newsmakers.